Welcome to all.
Well, I want to welcome everyone, and if any of you are newbies out there and have not seen any of our programs before, you'll know that you're in for something that should be very entertaining and very informative. Carl Palazzolo, if you've seen the advertisements he put out, you know that he's, what is that? I'm hearing some problems here. There's that Carl runs is both a veterinarian, particularly for wildlife, and also runs adventure trips for photography in faraway places. And you may be mentioning that as he goes along. At any rate, we may as well just get started right now then, Carl.
Thank you, Herm. Good evening, everybody, and thank you for the opportunity to share my veterinary experience working with wildlife. Since you are an Audubon group, of course, I'm going to center my presentation around birds tonight. My presentations tend to move at a fast pace. This is partly because I want to keep you awake. I know it's getting late over there for you Michiganians, but mostly because I only have an hour to share over 4 decades of information. So I want you to understand that some of this information will be available again later on through the link on Zoom, but also it's available on my website. If you type in lbah.com, click on services and go down to wildlife care, you'll see all the photos from tonight. In addition, you may want to go to the photography link to see much more about what I do with the photographic parts of the things I do with wildlife. I think most everybody knows it's going to be a graphic presentation tonight, so if you have to, you can put your hands over your eyes if you have to for some of the surgery photos. Okay, my story starts in Rochester, Michigan at the Oakland Animal Hospital in 1978. It was my first chance to work with wildlife. The owl's name was Professor Hoot. Didn't do a lot of wildlife work back then, but in 1980, I moved to California and I started working at the Sunsurf Animal Hospital. Again, I did mostly dogs and cats, just like in Michigan, but now is my chance to work with what we call the more exotic type animals. And what does that mean? It means animals like this, animals like this, and animals like this. And which is funny about all this, these are the exotic animals. The most exotic part of everything was the clients, not the animals. In addition to clients owning pets like this, I had a chance to work at a local zoo called Lion Country Safari. So I got my fill of the zoo animals. It was really great. We even had a famous actor come in. I would love to say it was Clint Eastwood, but it really wasn't. It's one of the orangutans, and it's pronounced orangutan, not orangutan. It's one of the orangutans in the movie Any Which Way You Can. And here he is in the reception area in my office, sitting on his trainer's lap. Every time I see this photo, I almost start laughing, thinking, is that a Wookiee or is that a human being in an orangutan costume? It's hilarious to have him come to the hospital. And you can see how his feet are like hands, how he hangs on to you. So he would sit there and wait for me patiently. Sometimes we'd give him some coffee to drink. And eventually he'd come into the exam room and I would go ahead and do my exam on him.
That's him.
That's him, okay? His name is CJ. So I'm examining his mouth, his eyes, his ears, and it really whetted my appetite for these really interesting, unusual animals that are our cousins. So this got me going on some trips. And then 9 years later, I was in Borneo examining a baby orangutan, the real deal. And I went back 21 years after that then too. So in part of my presentations in the future, if you want, we can do one on what it's like to go to Borneo. What a fascinating spot. In addition, at the Sunsurf Hospital, I had my first introduction to the marine mammals. Baby harbor seals, baby elephant seals that got injured, cute little guys with stinky mouths, okay? They needed a lot of care and feeding because they had parasites and worms that we would take care of, but what a fun experience to have these little guys running around the hospital while we're taking care of the regular clients. When we had the baby sea lions, they would come in weak with parasites. We'd temporarily get them strengthened up. We'd have a bunch of our clients come with the pickup truck. We load them in a burlap bag, drive down Pacific Coast Highway, and take them for long-term care at the Marine Animal Care Center. So it was a great time to learn about all those different kinds of animals and different things in life over there. And then, since this is a bird presentation, this is the opportunity I had in my life to really hone my skills working with a lot of the shorebirds. And probably one of the biggest things I did back then is take fish hook out of pelicans and other wild birds' stomachs. I would say around the late 80s or so, we had somebody maliciously in Dana Point, California, that's between Huntington Beach and say between San Diego, about a half hour from me. He was literally cutting off the beaks of the pelicans. People assumed it was a fisherman, but what was really interesting is there was a veterinary team that did an outstanding job. I got to learn from them a lot. They made a prosthetic beak and they actually put those pelicans' beaks back together. So there's a lot of innovative people who are trying really hard at the abundance of wildlife happening in California. And then in 1989, I purchased a Long Beach Animal Hospital. And again, I did the same kind of thing as I did previously on Sunsurf. And since you're bird people, we're going to show you a little bird presentation here. This is a macaw that has a bell stuck on its tongue. And we all know that the tongue of a macaw is a very sensitive thing. So I decided, well, let's gently put some mineral on it. There's the mineral oil with the swollen tongue. And if I gently push it through the backside, it's going to come out. Well, no luck. It was too swollen. And we don't want to fool with the tongue like that. So we actually took some special scissors we used in surgery. And I very gently and very carefully cut the bell off the macaw. And you can see the tongue is swollen, but it's no worse for wear. And there's our culprit right there. This is the guy that caused all the trouble. Since we're talking about reptiles, I'm going to change the pace for a couple seconds. I have a question for the group now. Does anybody know where we get a blood sample from a snake? This is my staff, Terry and Daniel, showing you the spot. They turn the snake upside down, and we get it from the heart. It comes from the heart. So how do you find the heart? You got to watch the beating of what we call the ventral scutes in a snake. If you can't see that, then you can go ahead and put a Doppler on, and you can actually listen for the heart. So we usually watch for it. It's a fun job to do it. And there we are taking a blood sample directly from the heart of the snake. Why would we do that? Well, the snake maybe is sick. We're trying to figure out what's going on. And on occasion, we do a surgery to take a towel out of a snake's stomach. So some interesting things happen in all these animal hospitals. Thought I'd throw in a little bit of something different for you on the reptiles. Okay, let's get now to the network of people that take care of the wildlife. We're going to be in Southern California. The work that I do is between the Long Beach area and the Huntington Beach area. We're about an hour south of Los Angeles, about an hour and a half north of San Diego. So this is the Port of Long Beach. That's right here, the Port of Long Beach. So I'm at the Long Beach Animal Hospital. We see about 1,000 injured wild animals we treat for free every year. We work in conjunction with several other groups. One is International Bird Rescue that has their own veterinarian, does their own work. And also down here at Wetlands and Wildlife, where we do work with them. They don't have a full-time vet. We do part-time vet work for them, but they also do some rehab work, which is really nice. And so we have two places that do the rehab work, and we have 1, 2, 3 doing the veterinary work. The veterinary work that we do, if it's raptors, birds of prey, we send them to South Bay Wildlife Rehab to do their work. So where does all this wildlife come from? It comes from all throughout the Southern California area. There's a lot of urban environment that has wildlife in it. But the three main areas are the El Dorado Nature Center, the Seal Beach National Wildlife Refuge, and the Bolsa Chica Ecological Reserve. It's called Bolsa Chica Wetlands. Bolsa Chica is Spanish for little purse, and it's one of the few remaining wetlands in the Southern California area. So I live right here in Sunset Beach. I'm in between the two spots. So that's how we operate the system. And I went to Wetlands and Wildlife one time for some surgery. We'll do a quickie here before we get into the big surgeries later on. And it is a cormorant that's got a fish hook stuck in the stomach, in its esophagus in this case, something not that unusual. So what do? Here's our patient prep for surgery. And this is literally me pulling the fish hook out of the esophagus. And I'm showing this one not for the surgery per se, it's to show you the final outcome. Here's our bird afterwards warming up in a heat lamp as it's getting prepared. But this one really gives credit to Lisa Peroni and all the people at Wetlands and Wildlife doing all the behind the scenes work, because this one was a successful release in the neighborhood at a pond. So he's a happy camper right now. And the goal, obviously, for all the wildlife that we take care of is for us to release them. Unfortunately, I would say we're probably successful maybe around 50% of the time, which is a relatively high percentage when you consider that most of these birds come in very, very injured. So who are the people that bring them in? Animal control of Seal Beach, Long Beach, Orange County, fishing game, the lifeguards, the police officers, a lot of individual people. On occasion, I bring them in. I went for a walk one time on the beach in front of my house with the neighbor, and I saw this bird up ahead, and sure enough, it was an injured grebe. So it was a morning walk for me before I went to work. So this is a great opportunity to bring this little guy into work. And you can see the injury he has right here. He's got a badly lacerated skin in the back of his neck. So perfect timing on my way to work, and I had the bird come in with me. So when people bring in wildlife to our wildlife program at Long Beach Animal Hospital, we really want to only care for injured wildlife. They fill out a form so we know where they came from, what they've done with it, where it's been, so we can hopefully release it where they find it, which is the ultimate goal. So we want to take care of animals like this. It's a really, really busy time. You can see here how busy we are with all the wildlife we can take care of on a single day. And the animals that come in are things like this: a bird stuck in a glue trap, a little baby bird with a broken wing. Unfortunately, in the springtime, we get overloaded with baby birds that are not injured, but they're just way too cute, little guys like this. So we frown upon that best we can because we're not really equipped to spend hours and hours feeding them. That's for the rehabbers. But I've got to admit, they can be super cute. As you can see the way this little hummingbird eats his food as we're feeding him. The tongue is just amazing. We should look close up at the tongue in action in a second here. So what we try to do is educate people on what to do when they find a baby bird. And we have something on our website and our Facebook page. It talks about what to do if you find a baby bird. I got this from the Wild Sun Rescue Facebook page. I've been there. It's in Costa Rica. It's a great organization run by Jeremy Levine, where they work on a lot of Costa Rican wildlife, especially monkeys electrocuted. So if you get a chance, have people read this. It's on our Facebook page. It's on their Facebook page. And the main thing is oftentimes return them to its nest and just don't interfere with nature. Nature's the best way to approach the non-injured wild birds. And you can see right there the spot I want the people to read. Okay, we have a lot of students come with us. We have a program called the Externship Program, where students from throughout the country, they must be senior vet students. They spend at least a month with us. They get to work with us, and a lot of them get exposed to working on some of the wildlife. So this is Ellie. Turns out she's from Michigan State, and she got an opportunity to learn how to go ahead and palpate the wings of an osprey to make sure there's no broken bones. We have a lot of students come through the program, and sometimes we like to play tricks on them because pelicans have lice. Lice go on people. The lice only stay on for 15 minutes or so, but we don't tell the students that. So when they come in to examine a pelican, after a few minutes, all of a sudden they're scratching their head because it's filled with lice. I think Kelly got the heads up here because she put on some gloves and she made Julio put a towel around this guy so she wouldn't get the lice. But it's a lot of fun to play a joke on the students sometimes. We got to give credit, though, to the rehabbers, the people behind the scenes, the students, because as we do the sophisticated medical and surgical work, it's really the people behind the scenes doing things like Elizabeth there, working on this duck's neck, and all the rehabbers who do an awful lot of the work to make us successful and make us veterinarians look good. So once these animals come in, we let them warm up a little bit, leave them alone a few minutes, let them get stable, and then we want to do a little bit of diagnostics. Sometimes something as simple as take a tiny bit of blood, and with that little bit of blood, we can run a blood glucose to make sure they're not hypoglycemic, which is important to us. We can go ahead and take more blood. Sometimes we take the blood from the wing veins, sometimes the jugular, and we'll fill up some tubes of blood. And then what we do with these tubes right there in the hospital rapidly, we can go ahead and spin the tube down. There's a tube filled with blood. When we spin it down, we have the red blood cells and we have the serum. And then we can do two quick, inexpensive tests that give us a lot of information. One is we can check to see if the bird is anemic by how many red blood cells are in there. And the second thing we do is we break open the tube where the serum is. We put that on an instrument called a refractometer. Then we can check how much protein's inside that bird system. Very beneficial for us in such simple tests. If we have a more sophisticated situation, want more information, we'll submit more blood. We send it to our reference laboratory, and they're very good. They know we take care of wildlife for free, but provide free blood occasionally on the animals so we can get a lot more information if we have to on some of the things. So blood samples are very important to us in diagnosing what's wrong with some of these birds. Obviously, radiography is very important. This is a normal bird. This is a normal hawk. I want you to see one thing on this. Notice this humerus bone here, how it's kind of dark. And this bone over here, this tibiotarsal, is not so dark because part of the bird's breathing apparatus is through the bones. Let's do a little fun show and tell one. Everybody knows about herons. This is a heron. You can see the big eye in it and how they crook their neck when they go ahead and attack the fish in the water. Well, now you can see how their vertebra gets coiled up when they go ahead to attack the birds. Okay, so once we go ahead and diagnose them, we want to treat them. Sometimes just some fluids given intravenously like that. Other times we do whatever's needed to be done. This is Dr. Yamamoto. She's certified to do acupuncture in animals. So we had a duck come in and she gave us some acupuncture treatment. Here's one of the students from years ago, Dr. Lisa Swan, sewing up a laceration on a red-tailed hawk, and she got the honor of releasing the hawk. We work a lot with local people that are falconers. This is Lori. She's a falconer. This peregrine falcon came from fishing game that they wanted her to rehab it to release it. So we have a lot of good experience working with them because luckily we see them at work. And we see peregrine falcons in the urban area because in downtown Long Beach in the high-rise buildings, it's a great spot for them to lay their eggs and have safe nests. And also there's plenty of pigeons around for them to eat. So it's not uncommon for us to see peregrine falcons. This one came in with a bad wing. Turned out that there was no fractures on the wings. Everything was okay with the bird. So this one was wrapped up with a special wrap and sent out to the rehabilitator. Here's another peregrine falcon. Looks like he went too fast one time and crashed into something because he's injured his cere. We call the front of the nose the cere, C-E-R-E. Radiograph on him showed that he had no problem. And then we put him in a little wrap. This guy was pretty feisty. He was a big fighter. So we wrapped him up off to the rehab center and he was taken care of successfully. So it's fun to see kind of birds of prey like this. We also work closely with Fish and Game. In 1997, a long time ago, they brought in a bird, a hawk that had an injured eye. Well, the eye was injured, okay? You can see it there injured. And we looked at the other eye and we saw it was okay. So I wondered, that's kind of fishy. So I took a radiograph and sure enough, somebody shot the bird in the eye with a BB gun. You can see it on the two views here. Well, it turns out the person that called Fish and Game that said he had this hawk is the person that shot it. And they prosecuted him. So it's good satisfaction to see that happen. Sometimes my staff fools me. They said, Dr. P, we got your next patient in wildlife. It's a butterfly with a bum wing. And I thought, what, are you kidding me? Sure enough, somebody found a butterfly with a torn wing. Well, there's no medical book we go to figure out how to fix this. So I put some tissue glue on. You can see some tissue glue from surgery. You can see it better from a different angle now. We put the wing back together. We filled them up with some high octane. I did a little test flight on my finger. Looks good to me. Took him outside and he flew away. So we had a successful release. Okay, that's a little bit of background. Now let's get into some of the cases. So this is a fun case. This is a barn owl hanging from its wing on an overpass in Long Beach, California. This little story is to illustrate how everybody worked together. Long Beach Animal Control, Long Beach Lifeguards, Fire Department, Long Beach Animal Hospital, South Bay Wildlife Rescue. It turned out to be a real good thing and it shows a network of people can work. So here's the lifeguards coming, cutting down the owl.
The place in Northern California. It was so big it took 3 of my staff to get it out of the car. We're in the exam with this guy. Wherever he went, we had to go with us. It's pretty amazing to work on a snake like this.
I don't know why that's playing like that. So here we have us having then the staff coming in.
Actually,
you can see now.
Guess what this one has?
Story on when it came in.
Almost stuck in the stomach.
I can play this without any circumstantial trouble here.
They were able to cut the line and catch it in a net. The owl was released to Long Beach Animal Hospital for treatment.
She's in pretty good shape. She's a juvenile female and her body condition is good. But as you can see, her right wing is drooping to the side where she should be holding both wings tight to her body. So we took radiographs of her and did not see any fractures in any of the bones of this wing or anywhere else on her body.
The owl will stay at that hospital for a few days before heading to a rehab center. And once she recovers, she will return to the wild.
So let's go over that case a little bit. We'll show you a little exam findings on the bird, the x-ray, and how we released it. So here's our patient in the hospital. You can see the wings drooping a little bit. Let's do a little show and tell anatomy. Most people don't know that birds have ears. And so this is the ear of a barn owl. You can see it right here. I'll show you a close-up. So ears are very important for birds of prey like owls because a lot of their hunting is not just with the eyes, but what they have to hear. So here's our radiograph. You can see that a barn owl is kind of funny on the inside in x-ray, but there's no fractures. And we went ahead then and put our usual wrap on it. back in the cage to rest a little bit, make sure it's stable. Then off it went to South Bay Wildlife Rescue. And here it is now about a month later, and we had a nice successful release of this bird back in the spot where it was found. And what's kind of interesting is apparently it went back into the tree where it was found at in the beginning. So here's a little video of the release in slow motion. And off it went. So after the release, the 3 people that worked on this bird quite a bit, and they're in this video right here, I said to them, let's do an interview. Why don't you tell us what you did with this bird, okay, as part of the treatment? And so I had them do a little talk on what they did. This one here was very nervous. They were all nervous, but the funny part about the video is at the end, I said to them, wave goodbye, and eventually they caught on. So it's a cute little video explaining what they did, but mostly to give them credit for doing most of the work on the bird.
My name is Officer Cunningham with Long Beach Animal Care Services. We received a call about a bird hanging from a bridge underneath 2nd Street and Studebaker. When I arrived, I did see a owl hanging from its wing, hanging from some fishing line. I immediately called lifeguards who were able to get a small boat out into the water due to the water dropping. And we were able to do a 1, 2, 3 and hurry up and get the bird onto dry land into carrying off to Long Beach Animal Hospital.
I'm Dr. Liz Wood from Long Beach Animal Hospital, and when we received the owl, we first noticed that one of the wings was drooping away from the body, and it still had remaining fishing line in the ends of the feathers. So we cut that away and took radiographs and found that there were no fractures of the wing. There was significant soft tissue swelling and a soft tissue injury from the weight of the bird hanging from the wing, but no fractured bones. So we treated it by wrapping the wing and also giving it pain and anti-inflammatory medication and antibiotics, and kept the wrap on until the wing was no longer drooping from the side of the body, and then transferred it to South Bay Wildlife Rehab.
We received the bird from Long Beach Animal Hospital and continued the care. We kept the wrap on for a little bit longer, kept it on medication until we were absolutely sure that that wing was healed. Once it did heal, and looked strong enough for the bird to go into a flight cage, we transferred it to one of our large flight cages where the bird had time to strengthen that wing so that it is ready for release back into the wild.
Oh.
There's the goodbye. So not all cases turn out as good as this one. We had a situation where we had a gull come in. It had a fish hook inside of it. I'm going to show you the surgery on that one, and this one unfortunately didn't make it. So here we are anesthetizing it, and you can see under anesthesia with the special breathing tube. A lot of plucking of feathers, and we better have a strong vacuum or you're going to have a surgery room filled with all kinds of downy feathers. And you can see Brianna ready for the anesthesia. Okay, I'm getting ready to make the incision in the neck area, and it's a huge treble fish hook. This is the esophagus here. I'm trying to pull the hook through a different part of the esophagus. It was large, and unfortunately, it was just too traumatic for the bird. We got the hook out successfully, able to sew back the esophagus. Everything was okay, and there's the treble hook that was taken out. And then the bird woke up well from anesthesia. Here it is, just waking up from anesthesia. When it was stable enough, we put it back in this cage. And even the next day, I did fine, but unfortunately, a couple of days later, it did die. So we don't always save them, but we give it a try. You never know what's going to happen. Our next case is a fun one. This is a duck that was found at a pond. It was kind of a semi-tame duck. People were feeding it. It had trauma to its wing and its leg and the back of its head. So when it first came in, it was kind of scared. But in no time, this little guy went ahead and got used to us. You can see at first it wouldn't eat, but then it made itself right at home with eating. You can see how she's just still traumatized from everything, wondering what's going on. But it didn't take long till she was munching away. So she made herself right at home at our hospital. We let her walk around the hospital a little bit. Everybody got to see her and pet her because she was basically semi-tame, eating up a storm almost every day. And after a couple of days of eating us out of house and home, it was time for her to have her surgery. But I want to show you the diagnosis. So she's a problem. This is her upper arm, her humerus. This is her wing. And what's happening is she has an old fracture. The bone is broken here, and the rest of the bone is broken over there. it's never going to heal, and it's causing her trauma, it's causing her pain, and it's useless. So since she has the potential to find a home, we're going to amputate that wing, and we're going to cut it right through here. And the reason I show this case, it's a teaching case, because we're going to use the laser. We use a laser in a case like this because post-operatively, the laser has dramatically less pain, swelling, and inflammation. But just as importantly, during the procedure, it has what we call hemostasis. It prevents bleeding. And small animals and birds like that, bleeding is important. This is a great opportunity for us because we have a student out, and this duck was just so fun and tame. Here it is in surgery saying, okay, what's next? Here's our student learning how to listen to its heart, making sure it's ready for anesthesia. Here's Emily teaching the student proper restraint. Our student restraining the duck, and Emily giving some pre-anesthetic medication. Getting ready for anesthesia. Teaching our student how to put the endotracheal tube down the right pipe, not the esophagus, making sure it's going in the trachea, the windpipe. Okay. And then our little bird here. Okay. And when we go ahead and clip up the feathers, there's no clipping, we pluck them. And the feathers could be flying around the room everywhere. So when we pluck them, we have to have a strong vacuum there, or we're going to have to do surgery through a bunch of feathers floating around. And after we do that, that's not enough even too, because plucking the feathers on the skin surface, we can't get down to the skin the way we really want to. So we have to go ahead and use a hemostat and pull some of the feathers off that way. You can see right there too. And we pluck the feathers, these downy feathers, as opposed to clip them with the clipper, because this way they'll grow back faster. So while that's going on, I'm preparing the patient. Our student's getting the instruments ready, and then we pull out the laser, and I'm going to teach her how to use the laser. So I do most of the surgery. Okay, here I am holding it right here, and she gets a chance to do it. I hold her hands because I don't want her to burn me with the laser. Okay, let's review now what we're going to do. So this bone over here, you can't see it well. On an x-ray, it shows up so vivid. Oh, it's easy. Let's just use the laser and cut through the muscle tissue here. But when you get inside of there, it's filled with what we call chronic healing tissue. And there's also muscles, tendons, ligaments, vessels. It's not this simple to see. You're going to see that. So this right here is actually this here under chronic healing tissue. The other bone is over here. But I'm showing this picture to show you that this is the muscle tissue we cut with the laser, and you can see there's no bleeding, which is what we want. So our patient then waking up from anesthesia did great. Everything was fine. Our student learned an awful lot. And then our student here doing some range of motion exercises afterwards, after the procedure, to make sure the leg's doing okay. And this little stinking duck, normally we go ahead and we send them off to rehab centers. Let me see here, let's get this going. Our little duck here, instead of going to rehab center, wanted to stay with us. So up on the roof, we went ahead and had a great chance for it to do its own little rehab by itself. You can see the wound on its head. The leg was doing good. The skin was healed. So this one turned out quite well. And sure enough, we had no problem with the duck with this kind of personality finding someone to take it. And here's our person that took it right there too. Okay, our next case gets a little more sophisticated now. Now we're going to talk about a case brought in by Long Beach Animal Control. It is a red-tailed hawk found at the Long Beach airport. And here's our patient right here, getting stabilized. Okay, once it was stable, we brought it down for an exam. This is Jonathan. Okay. I'm not going to go into the theory about how we go ahead and fix a broken bone, whether we're going to use screws, plates, wires, or pins. This is interesting reading. It talks about the philosophy of orthopedic surgeons. If you go on our website to that wildlife care section and scroll down, you can learn a lot more about it. You can learn about that in this procedure now. So here's our hawk. It is a fractured humerus. It's a mid-shaft fracture. Note also too, there's 1, 2, 3 BBs this bird was shot with. So what we're going to do in the procedure is we're going to put a pin through this whole shaft. This section of the fracture is called the proximal segment. This section down to the bone is the distal segment. You learn how we're going to put an IM pin all the way through here, turn around and bring it back down through over here. So let's go over that surgery. So here's our patient. Now that we know it's got a bad fracture, fractures are painful, so we want to stabilize it with the bandage, and that makes a big difference to help minimize the pain. Also, we don't want the bone ends to be irritating itself more and causing more trouble. So Brian and Jonathan put a nice little wrap on it to make it more comfortable. And then we find out it's banned. The band number is 1967. Jonathan going on the USGS website, and you can see we put the band number in, learn about the bird, and we give them our disposition, what's going on with it. So it's a wonderful system where we can keep track of everything. A few days later, when the bird's stable, it's time for anesthesia. We mask it. We're teaching a student. These are my hands this time because the student's not experienced, so I'm making sure that they put the endotracheal tube in the trachea After they do, I double check to make sure it's in the right pipe. Once we're controlled with that, then I'm going to start taking photos. Alex and Brown are going to start prepping our patient. An experienced surgeon, Dr. Kennedy, is going to help my protege, Dr. Wood, on one of her first fracture repairs like this. So she's watching the situation. And one of the things we teach the students is if this was a person or a dog or a cat, this could be considered gangrene, necrotic tissue, dead tissue, amputation time. In a bird, it's not that case. You can have all kinds of colors on a bird, and the tissue is viable and healthy. So we're going to proceed with the surgery. So Dr. Wood now is setting up a little bit. Okay, she's draping. Now, Rihanna's telling us everything is okay, stable for anesthesia. Our surgeons are ready. So now we're going to watch the surgery. So remember, we're going to go ahead and put a pin up. This is the proximal segment. This is the distal segment, and you're going to see how we do the procedure. So here is the approach. We can see part of the distal segment bone appearing. After more dissecting, we see a little bit better. After more gentle dissection, now we've got the proximal segment. So this part of the bone goes up to the shoulder, this part to the elbow. And then our doctor starts taking a proper size IM pin, and we're going to start bringing it up to the shoulder with a pin chuck, and we use a special chuck. It's allowed a circular rotation and movement as opposed to pushing it up. And an inexperienced surgeon like Dr. Wood, it's one of our first times, we prefer not to use the power tools so we don't damage it, because these bones are kind of fragile. The cortex, the thickness of the bone is not very much at all, so we got to be very gentle. So she did a great job. Here comes the pin out by the shoulder. We'll put the pin check on it, reverse it, go back down. And now we come back down still in that proximal segment. And then we have to match the two ends, which is not easy. Because the muscles are strong, they're overriding. It takes a little bit of time and dissect to gently match them. So two surgeon technique, and eventually we got them matched up. One surgeon now is holding things together, and the rest of the pin now is going to be pushed all the way down through the distal segment. We pre-measured it to see how long it is, but it's still a guess. You'll find out later on how that works out. Then we also have to put more on there because the pin is not going to be enough. We have to put on what are called cerclage wires. And part of the skill is to tighten them down enough so that it's tight enough, but not so tight that we're going to crack this fragile bone. So once that's all done, we sew up the subcutaneous tissue, making sure we're over those wires for protection. Here's our patient still under anesthesia. You can see the IM pin sticking way out. You can see the long incision. We keep them under anesthesia and take them to X-ray so that we can see just how far down that pin is. We don't want to go too far, but too short. And in this case, we have optimum healing. So here's our pin all the way down, and it's right where we want to be, right to the edge of the cortex. So that's optimal. In addition, we have nice alignment of the cortex here, so we're very happy. This turned out very, very well. We're not done yet because we got to cut off the end of that pin, and that pin is very hard stainless steel, so we need a huge bolt cutters to do that. And after that, here it is, we go into X-ray, but first we do that again. We go ahead and we have to dry all the feathers, because moist feathers, when we put a bandage on there, can cause dermatitis and potentially maybe a fungal or bacterial infection. And we're going to have a long time healing. So before we put the bandage on, we want them nice and dry. We put on some bone wax, sterile bone wax over the edge, mostly for comfort for the bird, also help for protection and for infection. And then we go ahead and we bandage it up, and we bandage it up with a special bandage over that. Then also the bandage goes around the wing wrap. And here's our bird now completely done. But we're not going to wake it up just yet, because we don't want the bird to go in its cage groggy and start thrashing. So we keep the bird completely awake under 100% oxygen till it's fully awake and standing on its own. Then it goes in its cage. So then what we do is go ahead and make sure it's stable. We treat it with anti-inflammatories, pain medication, antibiotics. After a few days, it's eating good and doing fine. We double check the bandage. We make sure the incision's okay. The bone wax is fine. After a few more days, it's time for it to go off to South Bay Wildlife Rescue. Spends a good bit of time there, about a month or so. Comes back in for recheck exams to make sure it's okay. Recheck X-ray shows everything is great. The pin all the way down has only moved a tiny, tiny bit. That's negligible. That's not a problem. And more importantly, you can actually see now the callus formation, the bone healing very well. So we're quite happy at around the 1 month mark that everything's doing okay. Goes back to South Bay Wildlife Rescue. Comes back then in about a month or so. Everything seems okay. So it's time to take the pin out. And one reason we use a pin versus plates is because with the pin, we don't have to re-anesthetize our patients. So you're going to see Dr. Wood using a lot of circular rotation to take it out. But just as importantly, you're going to see that Dr. Wood is pretty happy at the end how the case went. So she's pretty happy how that case turned out so far. We're going to go ahead and do a little bit of range of motion checking of it to make sure that everything's okay. And you see how we do that in this next little video right here. So we got to make sure that everything's okay before we do anything further. And then we're going to show you the x-ray, what it looks like after we've taken the pin out to make sure everything's okay before it goes off to the rehabber. So now the pin is completely out. The wires are going to stay in permanently. They're light, they're not going to cause a problem. Our cortex looks great, so it's time for this guy to go off to South Bay Wildlife. About another month or so. And here's our patient over there, doing great. Everything's healing good. And Ann Lynch, the director, called me and said, the bird's doing great, healed good, but we can't release it because it's just not strong enough to hunt. But we're going to use it for a teaching bird. And get a phone call a couple weeks later saying, changed my mind, you can release it. So now we're going to take it to a location that's far from Long Beach Airport. Apparently, I think the FAA wants us to release the birds over 100 miles away. So South Bay has been doing this before. Here's Long Beach. I drove 3.5 hours with an assistant to a place in Lone Pine, California, a place they released birds at before. And it's a golf course that nobody uses. It's ideal for the birds release. So we had an opportunity to be with nobody around, and our friend took off and did just fine. And I got a slow motion video of him taking off right here. You have to do slow motion because he bursts out of there so fast, you won't be able to see him. So the system worked. It takes a lot of people, a lot of time and effort. We enjoy it so much. That was probably from the time the bird first came in till the release was probably somewhere around 4 months of age. And this is our last case now. It gets a little more sophisticated because now we're going to involve a veterinary ophthalmologist that does a lot of good work for us, Dr. Doug Essen. He works in our wildlife for us. So for some funny reason, we see a lot of owls, like these baby barn owls. A lot of the owls have traumatic injuries to their eyes. So this is an owl with the injury to its eye. This blood is in what's called the anterior chamber of the eye, and there's a name for this. It's called hyphema, blood in the anterior chamber. Luckily, that heals very good with topical medication. So we're going to start going over some cases with owl eyes. This one here has an ulcer. We have to decide, is this ulcer, this scar on the cornea, active or inactive? Because depending whether it's active or not, we do different medications. So one of the ways we do it, we put in a green stain called fluorescein, and you can see the fluorescein right here. It's not uptaken by the ulcer, so we know that it's not an active ulcer. So now we're going to get involved with what's called a cataract surgery. This is a saw-whet owl that has a cataract. You're going to hear now Dr. Essen, as he describes the surgery in the video coming next, how he took out the cataract. I want you to understand that really from the cataract you're thinking of, it's not the cataract of aging process. What happened in the owl, it got traumatized. The lens lost its lens capsule. The lens touched the fluid in the eye, and that caused it to become inflamed and cloudy. And that's what he calls a cataract. So whenever he says cataract, think of it more as this inflamed, cloudy lens that's got to come out of there. So we're going to have a little video here of the two veterinarians, Dr. Weldy with his owl, because there's two owls with eye injuries, the same thing. My Dr. Wood, my protege there, and you can hear Dr. Essen talk about the surgery. So you can learn a lot here, and then we'll show you the surgery after this.
Hi, I'm Scott Weldy. I'm the owner of Serrano Animal and Bird Hospital, and we have a great horned owl, a male that was brought into us a week or so ago from another rehab center. It had an eye injury to the right eye that has looks like it's swollen. And Dr. Essen, Doug Essen, went through it and looked at it on Monday, 2 days ago, and said that the lens had luxated and it actually was huge and turned sideways in there, which is causing distortion to the eye. So today, Doug Essen is going to do surgery to remove the lens. We pre-medded our bird already, and we're going to anesthetize him, intubate him, and put him on a ventilator. And Dr. Essen will work his magic to make that eye better. Hopefully, with a few weeks to a month's worth of anti-inflammatory stuff, we'll settle down the inflammation in this eye, and this bird will be releasable as long as he can get along with flying the way he is with one lens missing out of his eye.
So coincidentally,
we had a similar situation. I'm Liz Wood from Long Beach Animal Hospital, and we received another great horned owl, we think is male, from South Bay Wildlife Rehab Center with a very similar issue. We can see the lens in our bird in the right eye that it has luxated laterally. And Dr. Essen offered to do the same surgery and essentially try to solve the same issue. So we're going to we've also pre-meted this bird, and we will also be doing the same surgery to remove the lens, and then it'll be transferred back to a rehab center for evaluation for flight and hunting. And we're hoping that with this surgery, a previously non-releasable bird will now be releasable. So both birds have a very similar injury in the same eye, and we'll be doing both surgeries today.
I'm Doug Essen. I'm the veterinary ophthalmologist with VOC, Vet Ophthalmic Consulting, here in Irvine, California. And we just removed a cataract from the right eye of a great horned owl. The cataract was there, we think, because of an injury. The capsule which surrounds the lens was no longer intact. And without removal, the likelihood is that that cataract would have created chronic inflammation, significant problems, and maybe even glaucoma, as well as loss of vision, pain, even complications potentially leading to the loss of the eye. The surgery involved, first off, anesthetizing the owl, which is no small undertaking. We have some exotic specialists with us today who are very comfortable anesthetizing birds. After positioning, we used operating microscopy, as the human surgeon would do, things in very close-up detail. We opened up the eye, maintained the space in the eye with a special jelly material called viscoelastic, opened up the capsule on the surface of the lens, and then used a human phacoemulsifier to remove the cataract material. And a phacoemulsifier is an interesting little thing. It's a combination of ultrasound, which breaks up the cataract, and vacuum, which sucks the cataract out. After we were done with that, we closed up the incision and put a little anti-inflammatory medicine in the eye to keep it comfortable and free from inflammation in the healing process. In terms of prognosis, we hope this owl is going to do well. The lens has been removed. We, of course, haven't put a new lens in because nobody makes commercial lenses for owls just yet. But the other eye is functioning very well. This eye should be visual, even though it won't have the same visual acuity that it would have had with a natural lens. We've removed the cataract, though, so it's functional. And we've also controlled the inflammation by removing the cataract. So the plan is functional vision from this eye and hopefully a release and return to the wild for this animal.
So we're lucky to have veterinarians like this in our community that can do this sort of thing, because this is really a skillful thing with a lot of specialized equipment. So before we start the surgery, let's look at a cadaver eye and get an idea what he's going to be doing. This eyeball is looking in that way. This is the cornea. This is what we call the anterior chamber. When he talked about the viscoelastic, he's going to inject it into here to keep the globe intact so he can do the surgery. This is the iris, the pupil right here. It gives you the color to your eye. This is the capsule over the lens. This is in the both owls. This got torn. In the owl that came to our hospital, the lens got torn into the anterior chamber, so you can see it easily. In Dr. Weldy's case, the lens got torn and it went back into the posterior chamber. This capsule here keeps the lens itself away from the fluid in the anterior chamber and the posterior chamber. When it gets torn, that's when the fluid causes the lens to become inflamed, and that is the cataract you talked about. A lens is normally clear, but it'll become inflamed and painful and can cause glaucoma too. To continue on, this is your retina and your optic nerve. So when we do the surgery, Dr. Essen is going to make an incision right here with the cornea and sclera come together called the limbus. He makes a tiny incision. He's going to go ahead then, and he's going to go ahead and put an instrument in there, and the instrument's going to open it up a little bit. Then he's going to put in this phacoelastic to make this bigger. Then he's going to come along and with his forceps and clean up some of the joint capsule if he has to over this the lens capsule. Then he's going to put in the phacoemulsifier and break it up with ultrasound and suck it away. So let's get this party started. Ellie gets to go ahead and examine this bird to make sure it's doing okay. Okay, and here is our owl, the one that has the lens in the front there. You can see it's cloudy. That's not normal. That means it's inflamed. And you can see how it's distorted the pupil and the iris. So we go ahead and do a test for glaucoma with a special instrument called a tonometer. Checking both eyes. You can see the other eye is normal. Okay. Taking some radiographs, making sure there's no internal damage. Okay. This is now the day of surgery, Dr. Weldy's owl. You can see now the pupil iris is distorted, but you cannot see the lens back there anymore. Okay. And then you can see the normal eye. Ellie learned a couple of things about her externship program besides learning about medicine. She's going to learn how to set up my tripod for the surgery too. So here we are now doing pre-anesthetic on Dr. Weldy's bird. And like always, intubate them. Preparation, you can see now the bright light that Dr. Essen's going to use for the surgery. Okay. Here he is setting up his instruments. And these are all really refined, what we call ophthalmic instruments that we use only for eye surgery. He's going to use a microscope the whole time, and it's a teaching microscope. So all of us rotated through looking through this as he showed us important parts of the procedure. So here's our system set up. Ellie's watching from behind. Dr. Essen doing the surgery with the special microscope and instruments. At this point in time, Dr. Wood using the teaching microscope, another veterinarian learning. And here's how I took the photos with the macro lens here. I'm going to show you a combination of both owl surgeries because certain times Dr. Essen's hands got in the way, so I couldn't get the photo I wanted. So we're going to use a little conglomeration of both owls. Getting the eyelids ready with the bright light. Our patient is ready. This is the first one with the lens that's dropped in the back of the eye. Okay. So first thing he does is makes an incision at that limbus where the cornea and the sclera come together. Then he puts a needle in there so he can go ahead and put in that phacoelastic in there so he can go ahead and make the globe stay with this gel intact and easy to work with. Then he expands the size of the incision in the corneal limbus area. And then he takes his forceps to clean up what he wants to with the capsule over the lens. This is our owl now, the one that we worked on. You can see the lens right there. Same thing. You can see making the incision in this on the cornea scleral junction, making it bigger. And then he puts the vacoelastic in there. And then he sets up the phacoemulsifier machine. It's a high-tech machine. And you're going to see now how he inserts that right into where the lens is. And you can see now he's sucked up a little bit of it right here. He's broken up a little more and sucked up a little bit more. And we're going to show you a short video, the only one I had, because it was hard to film this because there's so many hands in the way. But you're going to see how fast it goes and what it does. I'm going to turn down the sound for 1 second here. So that's how it works. So you're all eye experts now. You can all probably do the surgery. After the surgery, he uses a real fine suture material called ADOT, and he sews the eyelid back, the limbus back together. And when that's all sewn, he cuts the sutures really short. Then he injects an anti-inflammatory in the conjunctiva to minimize inflammation. There's a lot of healing to go on here too. Here's our team afterwards. Happy everything went okay. Loading up in my car. Back at the hospital, our little owl. Okay, next day, putting drops in its eye. Needs lots of medication. The eye looked good. And here he is ready to go off to South Bay Wildlife Rescue. Unfortunately, we got a call a couple weeks later saying that he didn't make it. But the other owl did pretty good, so we're happy about that. Okay, so I spent most of my time here on medical stuff this time. I want to do a preview of some coming attractions since a lot of people watching from Michigan. The December issue last year of National Geographic has a great thing on the perilous things going on at the Great Lakes. I suggest you read it. I may go ahead in the future, if you like, do a series of a slideshow on a series of articles I wrote for a journal. I wrote a monthly wildlife photography article in a journal in California, and I named this one called As the Eagle Turns. It's a 5-part series, and why the eagle turns? It's a spoof on the old soap opera As the World Turns, but it's a showcase of what it's like to do wildlife photography, and it's not just about camera lenses. It talks about the mistakes I made, the foibles I did, the times I fell in the water, and eventually how I got the photo. So it's a story about how I scouted it out, got the birds habituated to me, how I eventually decided to put on some waders and throw my camera equipment in the kayak and go over to the spot where the birds were. I walked through all this mucky marsh, set up the kayak with my tripod and camera lens. I took a few photos with my drone. You can see my landing pad and takeoff pad for my drone right there, my makeshift one. I had assistants. Lauren's watching this presentation tonight. She's a brand new vet student at Ross University. Yay, Lauren. She came out to help me with many other students during the year. Here she is early morning scouting for Daddy-O, I call him. Daddy-O bringing his lake trout from Lake Michigan, which is about a mile this way, over to his chicks to feed them. And here's Daddy-O right there, bringing his lake trout in. And here he is coming to the nest with his fish. His chick is happy, his wife is happy, so everybody's happy. So I can do a slideshow on birds of Michigan, including the eagles. I can also talk more about work that Dr. Sikarsky did. He might come to my condo this summer. Maybe he's watching this presentation. He has 44 years of research and data on bald eagles. I think he's talked to your groups before. Anyways, we can include him with it. And also in the presentation on wildlife in Michigan, sticking to birds. This year, I finally got a chance to get up close to the colts of the sandhill cranes and get some good shots of them. So we can do some good Michigan stuff. We can also go photograph the loons feeding their babies. In addition to that, in the same slideshow, I can do one on Bolsa Chica. Remember, that's our wetlands. Bolsa Chica means little purse. We can get up early. We'll meet out there early morning, and we can do some good photography. In the wintertime, we have the white pelican show up. In the summertime, wintertime, fall, spring, all the time, we have the California brown pelicans. We'll get some shots of them diving in the water. We'll go ahead and watch the kingfisher, the belted kingfisher fishing. We got, in the summertime only, we have my favorite bird there, the black skimmer. We have the osprey year-round. They come in all the time for injuries. The osprey fending off his catch from a bunch of crows, so I know when he likes to fish. Okay, if you go there this time of year, January, February, March, the great blue herons are nesting in the palm trees, and when the sun sets, we get some great shots. They come in building their nests right in front of us. They play peekaboo a little bit and hide and seek, and they eventually come out. Okay, you can watch them fly away and go hunting, and they go hunting over these fields, and believe it or not, it's amazing what they get. They get animals like this gopher. Hard to believe that they actually swallow this whole animal. Most of the time when they go fishing and get some fish. And eventually, if we stay there long enough, in April-ish or May, it's usually around March or April, we can see some fuzz buckets coming out there too. So it's a great chance for wildlife in that area. If you want to go more than just go there and come over here, get a slideshow on and come over here and actually go out there with us, we'll take you out there. We'll pull out the big lens and cameras. We'll go to the area where the pelicans are diving for fish. This is Pacific Coast Highway on the other side. Or we can go walking where the osprey and kingfishers are. Of course, you're going to carry my camera equipment. We'll try and bust them. Okay. So I want to kind of give you guys a little quiz on something we see from Bolsa Chica. Where we're at in Bolsa Chica, right here to the Hollywood sign, is 40 miles away. And believe it or not, you can get that photo from Bolsa Chica. So if you can't get the birds in flight shots, at least we'll get this one for you too. To expand our horizons, this is the shot that Peter Reed Miller took on my trip to Africa. Fantastic photo. This is a picture of a tawny eagle chasing away a lapfish vulture from his nest in the Masai Mara area. So we can go to Africa. We can go to the Falkland Islands on the slideshow. This is a rockhopper penguin feeding its chick. Gentoo coming out of the water. This one coming out as being chased by a sea lion. We can go ahead and do a slideshow on the very entertaining Magellanic penguins. The king penguins, the black-browed albatross, entertaining. We watch them feed their chicks. You can watch me having breakfast with them one morning. So we can go there on the slideshow. We can expand horizons to go to the frigate birds over in Galapagos. We can go to Mongolia on 2 different slideshows, one in the summertime, one in the wintertime, how these people have a 5,000-year tradition. These are Kazakhs of working with the golden eagles. We can then go from our feathered friends to our furred friends and go to Katmai National Park and show how the coastal brown bears catch their salmon. We can go to the Serengeti and watch the cats hunt. We can go to Botswana and watch the leopards pose for us. We can go to Africa and work with the rhinos and do a lot of shows on rhinos and poaching in China and all those things. We can go to the Cheetah Conservation Fund. Okay. We can go see the gorillas. We can hang out with the Hadza, watch them go hunting. These people have a culture that goes back 10,000 years. We can go to the Arctic and we can see the polar bears. I got a trip there in April and in July this year, if the COVID virus permits. Okay. And we can also go back to Borneo and do a nice slideshow on the orangutans. Okay. So that's the end of my presentation. If you want to contact me, anybody, you can contac me at carlp@icloud.com. I can answer questions on students that want to become part of our externship program, budding veterinarians, people want to learn about photography, people that want to go on trips with us, whatever you want to do. If you don't want to ask a question now, then you can contact me later on. And again, to get access to this presentation again, lbah.com, go on the wildlife care link from services and go on the photography link. Okay, if anybody has any questions then, okay, here's your opportunity.
Hi, Carl. On any of the surgeries that you did you remove the BB shot from the birds, or you just leave it in there?
It's a good question. We never take them out. We rarely would take them out because to find them is hard. You're going to traumatize a lot of tissue. There's a potential for lead toxicity, but in California, there's no lead in the shot. In Michigan, you still have that there. And Dr. Zakarsky talks about that quite a bit. Eagles are killed in Michigan because they're feeding on roadkill because there's less food to feed in the waterways. They get hit by a car. And the second reason is lead toxicity because some of the shot in Michigan is still in lead. But here in California, don't have lead shot. So it's not worth the effort to cut them open, dig down there and tear it out when they do find. And that bird's a good example of that. So very good question.
Thank you.
Everybody wants. Go ahead.
This is Glenn. What about from a regulatory standpoint? What kind of permits do you require from the, say, the state of California or U.S. Fish and Wildlife Service?
For us, for rehabbers, they have to have special training, get a permit. For us veterinarians, we just apply with them and we take care of so many animals for them that it's not hard for us vets to get a permit. But we do have permission from Fish and Game, which you have to work on the wildlife in California. So the rehabbers have a special permit. We have, we'll call it, say, a veterinary permit to do the medical work on it. Does that answer your question?
Yes.
Okay, good. And yes, in California, we have a program. So when people bring in the wildlife to the Long Beach Animal Hospital, they're not allowed to take it back unless they're licensed. And it sometimes causes a little PR problem because, we found the bird, we've been feeding it for days, we brought it to you, now you're going to fix it. We want to take it back because it's our bird. And unfortunately, the bird belongs to the state of California. Unless they're licensed, we can't give it back to them. So on occasion, it does cause a little bit of, we'll say, a little PR problems with us, but usually people understand in the long run.
I have a question for you.
Mm-hmm.
Hi, my name is Kelly. So, question about when you remove the lenses of the owls.
Mm-hmm.
So, does that not affect their vision when there's one eye normal and one eye without a lens?
That's what Dr. Essen and Dr. Weldy, who have a lot of experience in that, said they can hunt afterwards. Okay. So I went by their experience. I've never had that happen before. And unfortunately, our owl died. So I can't tell you long term what happened. But the other one apparently did okay. Now, I'm not sure if they're going to release it into the wild, what they're going to do with it. But apparently, from what Dr. Essen says, in prior surgeries and other owls of wildlife and birds, they've done okay. That's pretty amazing, isn't it? Okay. Unless you want an event now, a lens to put in there, okay? You want to spend kind of money, we'll put it in there next time, okay? Like we're doing people, yeah. Now, remember, too, they're not reading newspapers, they're not driving cars. But then again, their hunting is very important to them. But also, you learn on owls, their sense of hearing is very important for their hunting, too. And so maybe they can adapt to that. It's pretty amazing.
Well, that was very interesting to me. I worked at a veterinary ophthalmology clinic for about 5 years, and it was exactly what we did with the dogs. So it was very interesting to see.
Good. Oh, thank you. Okay. I'm glad you got to see it.
Yeah.
Okay. Herm, you have a question? Any other questions?
Yeah.
Go ahead, Gail.
I noticed when you were doing surgery on some of the eyes, it looked like the other eye was covered. What do you cover it with?
Mm-hmm. He covered it only for protection so that it's just a surgical drape. That's all it is. There was nothing special to cover it. It's only so it's out of his field of surgery. That's all. Does that answer your question when you say covered?
Yes, thank you.
There's nothing special we have to put on the eye, just so it doesn't see it, so it's covered so he doesn't accidentally touch it or scrape. But more importantly, his field of view with that dissecting microscope is so tiny, okay, he's nowhere near the other eye in that case.
Thank you.
Okay. Anybody else?
So one more for you.
Sure.
So when you're up here, do you practice it all up here, or are you just vacationing?
I don't practice. I'm still licensed to practice in Michigan, and I've helped out in some areas down in the Detroit area. But when I come up there, I don't practice. I just vacation, and what I do is mostly I teach the vet students vet medicine. I teach wildlife photography. And for some of the veterinarians, if they want to get more involved with some of the wildlife, we'll help them. Myself, Dr. Marie Rush, he's aboard the Zoo Veterinarian in Alabama, is going to be there this summer. So if anybody wants some help with this, we can consult with you, help you, advise you, hook you up with people that have more information we don't have. For example, I got an email from someone about a problem, and I sent them off to International Bird Rescue for an answer to their question. So we're a good resource of information and training and helpful. So pretty much that's what I do most of the time. But I don't practice up there because I don't have a practice. And without having surgical equipment and x-rays and staff, it's hard for me to do all the things we saw in this presentation. So, but I will help the veterinarians, no problem. Especially with my colleagues too. They love doing it. They love to teach.
I have a question. Do you do work with well, a lot of reptiles and amphibians now are having problems with introduced or formerly uncommon diseases, funguses? Have you worked with that in your wildlife clinics?
Yeah, well, we don't get the reptiles as wildlife usually. Usually they're owned by some people. And almost always it's a husbandry problem when it comes to reptiles. So we don't really see a lot of wildlife reptiles in our situation. So maybe that's a disease you're referring to, they're wildlife only, as opposed to captive ones. Is that correct?
Well, I was interested in diseases that have, I've heard reports are into wild reptiles like snakes that are having problems in some parts of the country.
I can't say we at the Long Beach Animal Hospital have seen any more unusual than we normally do, and most are nutritional related. In the common green iguanas, it's the nutritional secondary hyperparathyroidism, especially a bone disease. In the snakes, it's the improper temperature, stomatitis. We get things like that. So that's mostly what we get most of the time. We get egg-bound ones where they can't lay their eggs properly, and we get some of them traumatized, et cetera. But nothing unusual that we've had in California over the last, 10, 20 years.
Okay, thank you.
Okay.
You mentioned, hi, this is Scott. You mentioned several trips that you were taking in the summer and later in the year. Are these trips that you lead, or these?
Yes. Okay. So I've been teaching wildlife photography for around 35 years. And I usually take people with me on the trip. Most of them are, we'll say, intermediate photographers to non-photographers at all. You have to be a photographer. So to give you an idea, we've been to Africa 9 times. So for the rest of the year, the schedule is we're going to go, just going with a handful of people. There's no openings for anybody on this trip. We're going to go to Svalbard. That's up in Norway by the Arctic Circle. We're going to take snowmobiles and we're going to go up to the female polar bears when they come out of their caves with their cubs to photograph them. It's a special kind of trip with special guides. Then we're going to go back there in the summertime on the boat, and we're going to cruise around that area and photograph the Arctic wildlife and the polar bears. Then the summer's in Michigan. Then after that, in August, September, we're going to South Africa. We're going to do a safaris, and we're going to also sedate a rhinoceros on each of 2 trips. And on the second trip, we're going to go to the Cheetah Conservation Fund and work with the cheetah. Then the following year, it's going to be Baffin Island, Canada for the polar bears and the narwhals. And then the following October, it's October of 2022, we're going to go on a Peter Pan trip. We're going to go back to the Falkland Islands with those little penguins. And that's October of 2022. And we're going to go see the elephant seals as they come on the beach, mate, fight, have the babies, and the killer whales are outside in the waters preying upon them. So we've got a lot of things planned over the next year or two, assume the virus lets us do that. In 2 of these trips, the one with the African one and the one in Baffin Island were postponed from last year, actually, too. So if anybody wants to join us, the photography link on the website gives you much more information about these trips than what we've done in the past.
Thank you.
Budding photographer, they're great for you, but you don't have to be a photographer. We have a lot of non-photographers come on the trip. So start saving your pennies.
You don't have to be a photographer?
They're not just for photographers. Anybody can enjoy it, and you're catered to as much as any photographer. But if you are a photographer, you can take from beginning to intermediate to advanced level 2, whatever you want to do.
Right. Okay. Great. Thank you.
Thank you.
Okay. Nobody else?
Carl?
Yes.
This is Herm. If there's no other questions, I'll finish up with a few of the things that I told you about earlier. Just a couple of announcements.
Okay. I have a Zoom presentation right now at 5 o'clock that I have to attend to, so I'm going to cut out. So thank you for letting me hear these slides and pictures, and stay in touch, okay?
We will. Thank you so much.
Okay, bye-bye.
Thank
Bye-bye.
you.
Thank you.
Thank you.
Carl.
Thank you, Carl.
Okay,
That was wonderful, Carl. Thank you so much.
glad you enjoyed it, okay.